I was watching the news at home last night, and a segment about Johnson & Johnson's vaccine being paused was then followed by multiple pharmaceutical commercials in which there's a long list of side effects listed, including blood clots, sometimes fatal. Can you just explain why this vaccine is being treated differently than everyday medications approved by the FDA and marketed to consumers?
Absolutely. So, I think there's a couple things happening here. One is that this actually demonstrates that the pause is happening out of an abundance of caution. It's a very small number of people, but it shows us that our post-vaccination monitoring system is working. So those drugs that we see on TV that are advertised, they're all approved by the FDA, and we just have to go back to the fact that this drug is available by emergency use authorization. So the FDA looked at preliminary data, and they made a determination that based on that preliminary data, it's safe enough to begin vaccination. So we use the post-vaccination monitoring system to see if anything comes up in the larger population. And the pause shows us that the data were found and that we're going to take a quick look and make sure that the vaccine continues to be safe. I do believe it'll come back online. I think they'll evaluate these cases, maybe change who has access to the vaccine or who's given the vaccine, but that the system is really working the way we want it to.
So, Lauren, when do you expect it to come back online? How long is this pause going to last? And even once it's over, if everyone says, it's okay, how big do you think the efficacy or the hesitancy question is going to be put back front and center after an episode like this?
Yeah, that's a great question. I think the pause will be a few days long while the ACIP relooks at the recommendations. Probably more data from data review from the FDA, and then they'll make a determination like should the vaccine come back, and if so, should it be in a different population? I think the hesitancy question is hugely important. We have to do a lot of legwork around what does this mean? Does it change who gets the vaccine? Is it still safe for who's receiving it? And why did these things happen? So then a lot of science will start happening on why these cases occurred. It's 6 cases in a very specific population, relatively young women, and there may be something else about them that the FDA will explore and make a determination as to whether or not they're a particularly susceptible population.
Right,
but
there could be a commonality. For example, I wonder what you think the commonality is. There was talk yesterday about the fact that maybe birth control could be an issue. Have you heard anything about ties between the two?
Yeah, I haven't heard anything specifically, but the age of the women, that would make sense. The possibility that they have some other, related type of issue going on might also be the case. The review that's happening right now during the pause, all of that additional data that wouldn't be sort of out in the general public because we want to also protect people's privacy and their protected health information, will be looked at through the reporting system and through their additional casework. And so that'll allow the regulators to take a look at, is it birth control? Do we need an additional warning or an additional step to protect people who are on birth control? Or maybe it's something else and a different subset of the population will want to protect. But either way, a lot of it will come down to messaging.
Isn't it a mistake to give this kind of messaging, Lauren? If there's only 6 cases in 6.8 million, I'm already thinking, okay, I don't want my wife to get this vaccine, but I don't have a problem with her getting on a motorcycle every day, which she does, and her chances of a fatal accident there are far better than 1 in 100,000. So, aren't we sending the wrong message when we pause a vaccine for such incredibly rare cases?
I would say that it's all about the messaging, right? So it's not that we're making a mistake by pausing it. we have an incredible view into the sort of regulatory process that we as a general population didn't always take the time to look at or see in the media, right? So it's playing out in the media in ways that it didn't used to. And it's important that it is, and it's important that people see that all of the steps that were in place to protect them are being taken and are being used. So I don't think it's the wrong thing to do. I think what happens on the other side of this pause will have to be very clearly articulated, and why the next steps happen will have to be clearly articulated. But I think the pause is the right thing to do to look into the case, because if you take the time to look at this and you find something related, maybe in this vaccine alone, maybe also in the AstraZeneca vaccine, as some of those cases are very similar, then you can protect a bunch of additional people from having to go through this by limiting who gets the vaccine. And so it may feel wrong right now, but we're not great at talking about risk. And so perhaps this actually just introduces how we talk about risk into the greater sort of common conversation.